Well, hi everybody, Father Alex here. Welcome to another episode of the Godcast. The Godcast this week is a special focus on the subject of ketamine. Outside of my podcasting, I've been following this subject matter very closely. It's something that's I've been heavily involved with over the last few months, and so this is a ketamine special, and the Godcast is with a lady called Jo Moore, who is the manager of the Birchwood and the Kaleidoscope Detox Centre. So I do hope you enjoy it. If you do, then please share it, and please check out many other interviews that I've done on here, and perhaps subscribe to the YouTube channel or follow me on X at AlexDJFrost. But for now, I hope you find this discussion on ketamine most useful with myself and Jo Moore. Well, I'm delighted to say that joining me on the Godcast this week is Josephine Moore, Jo Moore, who is the manager of the Birchwood and Kaleidoscope Detox Centre. We're going to have a conversation about ketamine. Jo, it's great to get you on the Godcast. How are you doing?
Thank you. I'm good. Thank you, Alex. Nice to be here.
Yeah. Well, thanks for coming on. You and I have got a shared interest in ketamine. But if we perhaps start, Joe, by giving some context to yourself and the work that you do, just tell listeners and viewers a bit about that.
Yes, I've been working at Kaleidoscope Project now for around 9 years, overseeing our 25-bedded inpatient detox and rehab in Heswall. And we've seen that significant rise in referrals for ketamine over the last 3 or 4 years now. And we can see sometimes 30, 40 per year, and it's now increasing to the same amount as last year's referrals that came through to the same within a small quarter. So it's a huge increase, really, that we're seeing, which is quite worrying.
So your site is on the Wirral. So just for people who don't know where the Wirral is, we're talking
Yeah.
Liverpool, Merseyside area. And what kind of people are presenting, Joe? Just tell us about that if you would.
So we take referrals from all around the UK. So we've got a bit of a snapshot, really. And it can be people that are being referred for drug, alcohol, including the ketamine detoxes. And mainly the people referred for ketamine are people with reduced appetite, low body mass index, nerve damage, that sort of severe drop in weight, which is sometimes half their body weight is gone in a very short period of time, with kidney and liver damage, people with deranged liver function tests coming through, and many people with incontinence issues and prolapses that are a concern to them as well.
Just explain to us, Joe, how it's evolved over those early days of people being referred for ketamine misuse to where it is now. Were you a bit in the dark about this? Was it new to you? And just take us on a bit of a journey from then to now, if you would.
So we've heard of ketamine in substance misuse, but it was mainly kind of used as that club drug element that would be used at weekends or to events. And there wasn't an issue before 2021 that we'd heard of. And in 2021, we had a trickle of young males coming through between the age of 18 and 24 that reported those incontinence and frequency in urination concerns. And we might have had sort of 3 to 5 during that first year. And we kind of raised that at the time as a public health concern because it had been unknown to us. And at the time, we just dealt with their symptoms as you would do with other medication and drugs that we detox from. And we're just making sure that people are comfortable, pain free, managing the frequency of urination with medication and the abdominal cramps. But we started to see a significant shift in 2023 where we would have people presenting with the significant injuries to their health and their bodies, which were irreversible at that point. And that's when we really kind of highlighted, look, this is going to be a significant impact to people's lives, to the risk of death, and to the increased cost to the NHS as well.
And what about the demographic? Have you seen a shift there? I mean, in my context, my early awareness of ketamine was in children actually, not even adults, was young teenagers. Have you seen a shift in that respect as well?
I think first of all, we started to see the 18 to 20-year-olds coming through, but obviously we only take people at 18 and above. So weren't then at that time hearing about the younger people coming through and being referred because we couldn't provide that care and treatment. Now we hear of 7-year-olds, 10-year-olds using ketamine, and people using it frequently in high school as well. And we're directing as part of a panel of specialists to be able to sort of allow that person to have that oversight on them and to direct them to the right professionals. It's very difficult because there's limited availability for people under 18, and they're stuck in this vortex of a grey area where they're too old to go into a paediatric bed in a hospital, especially if they're sort of 16, 17, and then they're too young to be able to access inpatient treatment services. So that's a real concern. But yes, we've seen an age rise over the last 12 months of use of people in their 30s and 40s as well, and even people in their 60s using it for pain relief. So people with chronic pain conditions not being able to have pain reviews on a regular basis, then turning to ketamine to manage that because it's a cheaper option for them.
Yeah. Just in those few sentences that you've said, Joe, you've highlighted that something I've been saying is that ketamine is not kind of just, you can't just put it on one shelf, can you? It's a very multi-layered drug that is impacting people at very many different levels, whether it is a child, whether it is somebody who's older in your 20s or 30s, whether it's somebody in a rural, well affluent area, whether it's somebody in an urban context. It literally is everywhere at the moment, isn't it?
Well, we've got people in affluent rural areas using it for weight loss, and they're people that are between the age of 30 and 50 having ketamine in tea, so having ketamine tea parties. And then you've got the other end of people that started to have it on a night out on sporadic occasions, and then they were already under the influence of another drug or alcohol, so mainly cocaine or alcohol, and they have replaced the cocaine. They're saying it's their replacement of the cocaine and the alcohol because the alcohol's so expensive, and so is the cocaine. So it's their cheaper option, and then that becomes quite a quick escalation from that first use to then that daily use for them. It's very, they say it's very Moorish, it's very addictive, and they like that disassociation element and feeling a release from reality, which is where we've come from with in regards to kind of COVID, really. Many of them relating that to COVID.
And in that, in one of those layers that you refer to as a vortex of a grey area, is a huge issue and concern for me around how do we treat people who are on the cusp of being 18 or younger, 17, 16, 15 bracket, where in context here in Burnley, I know that ketamine is in high usage. And so when somebody presents to um, uh, um, or reaches out for help, whether to a GP surgery or counselling or whatever, that the response I think is not enough. There is this vortex of a grey area and as you put it, it's like what do we do with that 16? So, and in my and correct me if I'm wrong, but my understanding is that it's a talking therapy. It's something that would be usually administered by the parent. And again, in my context, Joe, quite often the parent is actually somebody who's in recovery themselves, or in many cases, it's a single parent issue where the parent is struggling anyway and might be a contributing factor why their child is using ketamine. Um, I mean, I don't see any answers at the moment. I think this is a huge area for public health, for the NHS, all various areas of the situation about how to resolve this, about what we do with that younger group of people that are effectively addicted to a very dangerous drug.
I think for us, we see lots of different dynamics, family dynamics. We see very supportive working parents who are able to support their loved one at home and care for their needs, but are struggling with that psychologically. So they're not struggling with paying for incontinence pads and sometimes paying for the private care element that they're having to go elsewhere for because they feel like they're just banging their head against a brick wall. And we've got other people, like you say, those people with a substance misuse history, people with mental health diagnosis, and their children are becoming unwell with the addiction, and they're at a complete loss. Many families have had a disruption, so those adverse childhood experiences relating to bereavement or relating to a family breakdown, that marriage breakdown, and being left with just one parent in the household. And we understand that obviously the benefit system is difficult and parents are having to work. And sometimes there's long periods where the children are left at home on their own and they need that care and nurture, and that's absent. And I think we've become a society of parents that are used to seeing their children spend long amount of times in their bedrooms with social media, with their Xboxes. And it's just the normal. No one's kind of eating around the table anymore and they are just absent. They know that they're in, but they don't know what they're doing. So many people come to us and say, I found a bag of incontinence pads, and I don't know where to start. And that's the first time that they've realised that their child's got a problem because they spend a lot of time in the rooms, they spend a lot of time in the bathroom, and that's completely normal.
Mm.
So it's taken a while for parents and caregivers to understand that there's an issue.
Yeah. And again, with it being very multi-layered, I've got lots of different tangents that I'm going to go off here because I've got so many things racing through my mind. But what you said there about the family context is that, and also the idea that the child is spending a lot of time in isolation. And one of the
Mhm.
reasons why I want children as year five to be educated in ketamine abuse is because of what I'm hearing from primary school head teachers who are telling me that they are pleading with parents to check in what their children are doing and what they are watching and what they are listening. You know, the amount of rhetoric and anecdotal evidence that head teachers have given me of year five and year six children using sexual connotation discussions, sexual images, pornography, all those kind of things. Because when I've said to people, what, and I say year five need an education in ketamine, they're like, "What? No way!" But would you agree with where I'm going with this?
It's a reality. That is the absolute reality. We are not able to understand fully the easiness and readiness of that social media and the content that they're seeing. It's almost that our children have just become more techie than we are, and that's real. Um, and I look at my son. Would I have been able to know what he was doing in his room from early senior school maybe and through college? I wouldn't have had a clue.
Mm.
I respected that boundary of the shut door, and I had a password protect on things, but actually the children bypass these things often, and they're able to see certain trends. So if they watch something, say on TikTok, and they watch something that's leading them down a path of being interested in ketamine and somebody promoting that use, very quickly their trend on TikTok and all of their information will come up with positives around why you can use ketamine and that fun element and the party element. So I think that we're kind of really behind the times. I don't always have an answer for that, but I do believe that by allowing children to be isolated and away from that family support, out of the way, that they're not really playing out that much anymore. They are just in the home and they're watching all of these social media content around, body image and glorifying, gangs and knives and things like that. And we just are entangled in that, and it's very, very hard to unravel it, I think, and start afresh. But I do believe that if families ate with their children and spoke to their children and got them into that routine and normalized that instead of allowing people to go off and do what they want to do and leaving them to their own devices.
Yeah, I mean, I've heard I've had people approach me, mums who've said, my son is whizzing around in all sorts of decent gear. He's got the North Face tracksuit and the Nike trainers. He hasn't got a Saturday job. I'm not giving him any money.
Yeah.
And they're being attracted by ketamine as actually a way of making money as well, aren't they?
Yeah, yeah. A lot of them are dealing for their own use as well. It's quick and easy. They're sucked in by these gifts that they're getting. And a lot of people, like you say, zooming around on bikes or scooters or even storing the ketamine for people. And I'm talking large amounts
Mm.
in the bedrooms. And, they're taking it with them when they go out and dealing it to their friends at school. It seems very normal. And a lot of the clients that we have here that have dealt ketamine, they will say, I feel terrible now, I know the harms. That's one of the key things is they don't recognize the damage that it can cause to their body.
No.
And, they've heard about the bladder issues. But when we really get deep, into those physical concerns or psychological concerns, they are really quite shocked. And when they see some of the most severe people that we look after, the ones that are not as entrenched, it's a big eye opener for them.
Yeah, and again, I'm hoping people who are watching or listening to this are seeing how multi-layered this issue of ketamine is. Can we just talk about the drug itself, Joe? Tell me about your feeling towards it and your interpretation of it, and then perhaps move on to whether you think that it being a Class B is significant enough, or what changes you'd like to see.
Yeah. I suppose everybody calls it the horse tranquilizer. And I think we've got to move away from that. Ketamine is used for the right reasons by the right healthcare professionals. Whether it's in acute medicine, in theatres, and even for depression. But it has to be monitored and it's micro dosing compared to what our ketamine users are using at the moment. And they can use anything from 2 grams to 20 grams per day, a significant amount, really, at a very low cost. And I think, when we look at the Class B element and the review that's taking place, we don't want to see anybody criminalised for taking ketamine. We don't want anyone to be criminalised for taking drugs. We believe in that rehabilitation and that hope and that process. And you're more likely to go downhill and spiral, with the forensic history, with that criminality, if you were to have prosecution and end up in prison. And I think there's lots of young people being pushed into and groomed and looking at that county lines issues and people cuckooing and all the rest of it. They're very vulnerable and it is not right to, uh, you know, chastise the people that need the help and support. More money should be going into inpatient detox and rehab. So I think if it went to a Class A, then we'd have more support from commissioners. We would have more funding, and people would take it a bit more seriously than they are now. But I think with other drugs, we've seen it increase with an increase in the category. So I don't think it will necessarily change the amount of people using.
Mm. And what about the relationship with, again, keep using this term multi-layered. What about the relationship between ketamine and the various services, whether it's social services, whether it is the police, whether this is a matter of addiction, whether it's a matter of exploitation, whether it's the relationship with the general practitioner or the NHS. To me, um, there's a there's a paper thin bridge between those links. I don't know if you concur with that, and there needs to be a lot more. Just tell me about your experience and your feelings about how we're more disconnected than we are connected as a body of people trying to solve this issue.
I think there's pockets of the country that are doing brilliant work in certain areas. For example, one area might have a great substance misuse service that is clued up on ketamine and they're working closely with urology and social services. They're delivering all of this training. Perfect. But there's no national response to this. And that's what's concerning is there's areas that are ineffective and letting people down and people are passing away. When I've spoken to the police and social services of the people that we train and introduce to ketamine, we're really surprised that they didn't know all of this information. But I have to remember, I was in that place at one point. I was very uneducated in that area and spent a long time, like yourself, talking to people that use ketamine and the family members that are going through that difficult journey. And I think if you're not willing to invest the time in learning about it and talking to the individuals who know more than most professionals, then you will be the person, sitting back waiting for it to land in your lap. And I say to everybody, you've got to get out there and find out what is your response as a service. How are you going to deal with ketamine? What is your pathway? What is your plan? And what is the money that you're going to be able to put in to support these individuals?
Yeah. I mean, here in Burnley, we have a group called Inspire, which is kind of the pathway for adults who present with addiction. But, some parts of the country, as you said, I was speaking to a lady in Lincolnshire. It seems it's absolutely woeful. And I think, the person that I might be referring to, the actual support for that individual is absolutely shocking. And that's another layer to the problem is that good parents are seeing young people's potential kind of going down the Swanee, for want of a better word, aren't they?
Yeah.
And not much there to pick them up and support them. And you and I will both have seen people who are perhaps on the other side or in a safer place than they were, but that doesn't remove the anxiety from the parents, does it? And the carer, when they go out what time they'll be back, or if they don't come back when they say they're going to be. There's always that concern that they're going to go and pick up some ket, and then it's just that revolving door of problems, isn't it?
If you think about a young person turning up to A&E with pain and they're urinating blood, and the first thing the doctor does is pull out their phone and Google what is ketamine. Where is the trust for that young individual? You've lost them at the window of opportunity.
Mm.
So that's why we're pushing with primary care, the frontline services, to be able to say you have to know what it is and how to deal with it, because otherwise you cannot captivate that individual need, that their need is not identified and they're just pushed out the door. I mean, I've sat in for hours in A&E with patients and begged that they would give them a bed. At least they might be there for 30 hours and said, look, please, can they have a bed? They weigh 6 stone. They're emaciated. They can't sit down without being in discomfort because they're urinating all the time or they've got a prolapsed bowel and they can't, they're not comfortable. They just have such lack of awareness around those symptoms and health concerns that they can't cater for their needs. We're getting somewhere, but we are so far off getting it right.
Yeah, I've my wife. I say I have a wife. My beloved, wonderful wife is an advanced nurse practitioner, and I know GPs as well who openly tell me that if a young person presents with ketamine, it's a leaflet. It's a leaflet. Go away. Talking therapies. Ring this number. Samaritans X, Y, and Z. But there needs a bit more than that, surely, doesn't there, Joe? There needs a bit more digging. Like, what's the underlying issue here? What's the mental health issue? Could I do a blood test? All those kind of things.
There's no assessment tool. So for an alcohol client or somebody that's on opiates, we will have assessment tools and clear pathways of what is needed to happen after that first initial assessment. So what we're trying to put together is we're trying from scratch to make an assessment tool. I've just started and nearly finished a questionnaire that looks at all the physical and mental health symptoms of ketamine clients. Again, it's only the ketamine clients that have spoken to me about it. There's very little research that we can actually identify with in the UK. So we're all kind of starting from scratch, but I wish it wasn't people like us, sometimes because I feel that I'm only new to this, but we've dug our head deep into it and we've wanted to rescue people and help people because we've seen that impact. And it's a true passion, isn't it? But I
Mm.
want everybody to be able to embrace this and have a UK turnaround of how we deal with this.
It's so true, and I reached out to my MP, and basically, kind of the general response was, we need to let the experts decide what to do next. And I'm thinking, I
There isn't any.
There isn't any, but I'm kind of one now because I've
Yeah.
put the time to get involved. There aren't any, so what are you going to do? Wait for no experts to make no decision? It is a real frustration. And what's your prognosis for this then, Joe? Where do you see this getting worse before it gets better? Do you
Yeah, I do.
just yeah, say something about that?
So when I review the deaths locally to me, and that's for drug, alcohol, and suicide deaths. And I know how long it can take for the coroners to get through those reports and reviews. And I think later this year into early 26, we will start to see a significant increase in the rise of those who have passed away due to ketamine. But it's not just the passing away, it's those ones with the life limiting and lifelong injuries to their body that we've got concerns about. Hearing about people having dialysis because their kidneys have had to be removed. Now, that's sort of £20,000 a year for the rest of their life. I mean, we need to invest now in that long term inpatient detox and rehab for them. And it's got to be around the person centered care, what the individual wants. But to be taken away from that using environment is really important.
Mm.
They need that break to be able to be looked after, for all those tests to be done in one place and to have those. I mean, look at the family support group that I run. We are literally begging. I've never had to beg so hard for a GP to listen to me to say, look, this person's lost 4 stone. Their BMI is really clearly very low and they are at risk of cardiac arrest now. Can you please do some liver function tests for me on that client? Oh, I'm not sure who you are. We're not going to talk to you. I'm not sure why you've got involved. And we've got the consent for us to be an advocate for the client, and the doctors are still very resistant in being able to follow our advice. And we live with it every day in, day out with these clients. And we see that we can do our routine blood testing whenever we want to with our pathway with biochemistry. But to just try and get a simple test or an assessment with a GP is very, very difficult.
And why is that?
Their lack of awareness, I think it's out of the ordinary for people to fight for people this much. We're taking time out of our day. We don't get paid for any of this work. It's something to do as extra. So I work with a social worker from Leeds, and together we combat each individual and support the family. We might do a safeguarding referral. We write to the GP. We might speak to the local drug and alcohol service to try and get an assessment or do a referral. These people are thinking, who on earth are these people? Why are they so urgently saying there's a big concern? And the majority of the ones that we have helped have had some treatment, have had those assessments, or have had an inpatient detox and rehab. So we're getting there, but I only deal with very low numbers for that family support group. I don't think I could cope with much more at a time because it becomes it overtakes your life. I don't know how you feel, Alex, but it just becomes something that engulfs you and you are entrenched in and you want to do more. But you look and go, well, okay, we know about ketamine. People are learning about it, but what are we going to do about it? And I think that's the problem on everyone's lips is what next?
Yeah, yeah, it's so true, Joe. I've become addicted to ketamine in a different way.
Yeah,
I
yeah.
can't shake it off. It's completely under my skin, and because of the reasons that you've identified. And what about just finishing up, Joe? What about people who might watch this out of intrigue or interest and think, who first is a ketamine addict? What would you say to them about a ketamine detox, first of all?
I think coming into detox can be quite scary for individuals. They think it's a jail and they'll be locked in their bedrooms. That's absolutely not the case. People have great facilities now where you have your own bedroom, you're looked after by nurses and doctors. And what we try to do is we try to manage the symptoms. So if you've got bladder pain or frequency in urination, you're passing those clots in the mucus. We're trying to deal with those symptoms and looking at things like a benzodiazepine detox to help you settle and calm yourself while you're here. But there's staff on 24 hours a day to come and speak to if you've got those concerns, and we're there to reassure people. So, many of the staff that we work with have also been in your situation. So they've been addicted to a substance and they've got better and recovered. So it can happen, and it gives you hope that there is that light at the end of a very dark tunnel for you.
And finally, Joe, what would you say to parents who might be watching this who may be worried sick? They may have heard about ketamine. They may have a suspicion that their child might be using it. What would you say?
It's going to be a fight, and you need to get those gloves on because you are not going to get anywhere quickly or easily. So it's about knowing the pathway of contacting the GP, having a backup, having your emails, contacting the MP, contacting the local drug and alcohol service, and reassuring the person that you're caring for that you understand it's addiction. There shouldn't be any stigma involved or judgment. It's about being proactive and getting that help quickly. And that's what is key here is the urgency into referrals and not waiting for things to progress and get worse physically.
Joe, I think this has been one of the most valuable podcasts that I've done. I like talking to celebrities and musicians, but I like talking about ketamine because it is a big one and it's so important and it's impacting so many people. So I'm really grateful for your time, and I just want to thank you for what you're doing in supporting people with this nasty drug. Thank you.
No problem at all, Alex. Thank you very much.